What's up, everybody? Nest Fitness up in this motherfucker. I just want to talk to you a little bit tonight about some injection techniques. This is something that can be a refresher course for the vets as well as it is for a new guy. The main thing about, your cycle is based off your injection. If you fuck the injection up, your whole cycle is fucked up. So, in my opinion, your injection is going to be the most important part of your cycle. And it's all about sanitation. You fuck around with sanitation, you get a damn infection, you're going to wish you hadn't. I can just tell you that much now. But yeah, let's talk about it. The first thing I'm going to do, I'm getting ready for an injection, is I'm going to wash my hands. I mean, it's common sense, but you wouldn't believe how many people just skip that step. Wash your hands. If you can use latex gloves, that's a good practice. That's the best practice. You got to treat yourself. Remember, you're treating yourself basically as a patient, and you're the doctor. You're treating yourself. You want to use every precaution that you can possibly use. I know a lot of you ain't going to do that, but it is the best practice, just so you know. I mean, it's one step that to go further and making sure you're doing a nice, clean injection site. In a perfect world, you would have a clean room just like you would at the hospital or lab. And I know you don't have that. I mean, you're at the house. So what do you have? You have a bedroom, a kitchen, a bathroom, or something like that. Pick the one that you think is the most cleanliest out of the whole bunch. And what I like to do is, you ever seen a beam of sun coming in through your window, and you looked in that beam of light in the sun right there, and you see all the particles, the dust, the air, all the pet dander, all that shit? That shit's floating in the air. So the first thing I like to do is, if you got any fans on, a ceiling fan, anything like that, and the window's up, go ahead and turn everything off, close your window, let everything settle down. Because that shit's floating in the air, and as soon as you pull the cap off your needle, that shit's going to stick right there. It's going to find that shit, and it's going to stick. So best thing you can do is turn everything off. Let it be nice and still. So you done got that far. Now you want to take some alcohol, rub it on your site, and what you want to do is, you got your alcohol pad. You want to start at your injection site and then work your way around and out at the same time, around and out. What that does is that pushes all the bacteria away as it's killing it. Another thing you need to do is make sure that it dries completely. If it does not dry completely, then it will not kill the bacteria. And if it does not dry completely, you'll know it when you inject, because it's going to sting. It's going to feel like a bee sting. You'll know. You'll be like, oh, fuck, I didn't let it dry all the way. Another thing is, you want to use the highest concentration pure alcohol you can buy. It's like $2 a fucking damn pint or whatever. Buy that shit. Don't fucking use witch hazel or some bullshit knockoff alcohol shit, because that shit is not going to kill the bacteria the way you need it. I know a few dumbasses out here that like to inject as soon as they get out of the shower, and they think just because they wash the ass that it's clean enough to go ahead and inject. Let me tell you something, that's stupid as fuck. Let me tell you why that's stupid as fuck. Because A, you already have bacteria living on your skin. Even if you wash your ass off, it's still going to be bacteria there, because that bacteria helps you survive, so it's there. Also, you got soap scum. It's there. You can't see it, but it's there. Depending on what kind of soap you use and everything, you got perfume, dyes, all that shit. Do you want that shit in your fucking muscle? Because I'm going to tell you right now, anything that does not belong inside your body attacks it, and it tries to get rid of it. And a lot of times this is going to lead to an infection or an abscess. So you don't want to do that shit. So I don't give a fuck how clean your ass is. Use the alcohol. That towel that you used, you just wiped your body off with that towel, and it's got all kinds of shit on it. And you just wiped it over your injection site 100 fucking times. That's dirty. It is not sanitary. It is not good enough. Make sure you use alcohol. All right, so we got that far. We got everything set up. We're clean. We're good to go. First thing you're going to do, you should have two pens. One to draw with one to shoot with. Your draw pin is usually going to be bigger. Everybody has their own opinion and their own ways on this. I use an 18 gauge. A lot of people like that's too big. Use a 22, 23 gauge, or something like that. The reason being is when you there's a plunger on your vial, and once you stick that needle in there, it's possible to get a chunk of that rubber stuck inside the barrel of that needle. And when you draw it out, you might get a little floaty of that rubber. Once you've drawn out a cc or two or whatever you're going to do, hold it up to the light and inspect it. Make sure that you're looking at it and you don't see anything floating in there. No chunks of rubber, no hair, anything like that. If it is, it's contaminated. It's no more good. Now I hear a lot of people talk about, well, can I squirt that shit out into a filter and reuse it or some shit like that? Let me tell you something. A fucking cc of test is only going to cost you about $5 to $6. I mean, it's cheap as fuck, man. Quit being a fucking tight ass. Toss that shit. If you got a floaty in that motherfucker of anything, I don't give a fuck what it is. If you see something in there that's not supposed to be in there, toss the whole motherfucking thing and redraw you a new syringe. Why are you gonna fucking sit around and dick around for 30 fucking minutes trying to fucking get a little floaty out? I mean, so you can save $5 worth of gear, and then it's probably even more contaminated the second time around now that you done fucked with it. So don't fuck with it. They do make some needles out there, pens and things that have filters in them. They're a little bit more expensive, but your regular pens and shit like that, man, the shit's so fucking cheap they damn near give it away. All you pay is shipping and handling. You can buy them by the box 100, man. It only costs fucking few bucks. So quit being a tight ass. Fucking toss that shit if you got a contamination in there. But anyway, you done poked your thing. I use 18 gauge. You use what you want. But I do it that way because it's quicker. I pen a lot of 3cc's, so I ain't got time to be sitting there drawing that motherfucker for 25 minutes. So put your damn needle in the vial, draw it up, pull your cap off of that needle, set it to the side, get your pen and needle, put it on. You done your inspection, you see it's clean, it's all good, take your cap off, then you're gonna hit your plunger. Thump it a few times, hit your plunger, get the air bubbles out. And it'll shoot the air out, you'll hear it come out, pff. It'll shoot the air out, and then let a little bit of that oil get on the needle. That's for lubrication. Some people, when they first start out, they're a little bit scared of the bubbles. You don't have to damn knock the bubbles out of there if you don't want to. But this is what's going to happen if you leave bubbles in there. Once that shit shoots out the end inside your muscle, it's going to hurt. You're going to feel it. It's going to hurt. That's why you want to get the bubbles out. If you're scared that you're going to die because you didn't watch too many fucking movies and you think if you get air in your bloodstream you're going to die, well, let me just tell you this much. It takes 3 cc's of air directly into your vein in order to cause you a problem and kill you. So you're not going to have that. So don't worry about that. You're shooting into a muscle. You're not going to be shooting 3 cc's of air. If there's a little fine bubbles in there, don't worry about it. Bigger bubbles are going to hurt when they pop out. That's why you thump it a few times, hit that plunger, shoot that shit out. Good to go. Now you've done that, you put your alcohol on there, you dry, you done shot the air out. You want to inspect that needle real quick in the light just to make sure there ain't a dog hair or a cock hair or a nut hair or anything else on that motherfucker before you inject. Now let's just say you see something on there. This is what a lot of guys do. You know what you just did? You just blew 5,000 million gazillion fucking damn bacterias out of your mouth right onto that fucking needle. Now you're going to stick it into your muscle. Now you got an infection. Don't blow on it. You're stupid. If there's a piece of hair on there, you might take the cap that you pulled off, the sanitary, that's been sanitized, and maybe you can just kind of, dust it off, dust that little hair off. But what I do is pens are so fucking cheap, man. I put the cap back on the pen, I toss that motherfucker, go in my drawer, and I get another damn pen and put on there, shoot shit back up, lubricate it again. Why the fuck are you going to sit there and try to do it? If that pen touches your shirt, if it touches the blanket, if it touches anything other than the cap, you toss that motherfucker. Don't risk your fucking health over a contaminated fucking needle, man. All it takes is the very most microscopic little motherfucking piece of shit to get on there, and you put that shit in your muscle, and as soon as that motherfucker gets inside your muscle, you know what happens? Your muscle puts a barrier around it. And now you got this little cyst that's got this thick tissue around it that your body's using to protect itself. And then you got that stuck in your arm for life unless you dig it out. And if you're using an inch needle, I don't think you're going to be doing no inch deep incision trying to pluck that little pit out. So the best thing you can do, you see something, just toss it, man. I just can't fucking, emphasize that shit enough, man. Be sanitary, be clean. The fucking syringe, the needle, the little shot of test or whatever you got in there, all that shit is pennies, man. It's pennies. Throw that bullshit away, start the whole process again. All right, so now you're good to go. You're ready to pen. So I have people ask me this question. If you look at the pen at the very tip, you'll see it's beveled. It's a little slanted right there. It's beveled. Some people want to ask, if the bevel's up or if you got it upside down, sideways, which one is best to inject? Honestly, I done tried them all the ways. Some people's going to swear by it. A certain one is going to be a certain way is going to be better. I done tried it every which way you can think of, man. And I'll be honest with you, I really don't see a difference. If the bevel is up or down, sideways, crossways, I haven't seen any difference. Now you have two techniques, and I've used both. Well, actually, you got several techniques, but here's two techniques right here that I've used, and there's not one better than the other. It's all about your personal preference. You can shoot the needle in real fast, pop that sucker in there, or you can go real slow, kind of put the tip on your muscle and kind of just push it in there. Different people like the push method. Different people like to go ahead and shoot it in there. Play with it. See which one you like best. Switch them up. Do whatever. My damn cat sneezing over here, fucking my chair up. But anyway, try different methods. Whichever one you like, it really don't make a fuck. Just play with it. See which one you like best. I've watched a lot of nursing videos and I learned about everything I know about injection techniques, intramuscular injections, all that bullshit. I learned on YouTube by watching nursing videos. So these are the same videos nurses in school are taking to inject you with, and that's the best protocol you can ever do. So they're right here on YouTube if you want to check them out, because this is how I learned. I watched them YouTube videos from nurse classes. Some people like to spread your skin and plug it in there like that. Some people like to hold it and move it to the side and plug it in like that, and they call these different things like Z-tracks and shit like that. And what it's supposed to do is when you let go of the skin, it moves back over, and therefore no blood or none of your gear leaks back out. The way I look at it is a fucking drop of gear leaking out of my arm or something. I mean, I don't give a fuck, man. You act like you done lost the whole vial or something. I mean, wipe this shit off, go on about your fucking business. But there's different techniques. Watch them nursing videos, and they'll show you a lot of shit that you help you out. All right, now you got it stuck up in your arm. Next step, which is a step that's you don't have to do anymore per se, but it's called aspiration. What that is, you pull back on the plunger, and you'll see whether or not any blood comes back. If it's no blood, go ahead and shoot. If it's blood, that means that it's likely you're in a vein. Not necessarily, and I'll explain that further in a minute. But if you go back and you watch these videos, which are current videos, they no longer aspirate in the hospitals no more when they give you injections. Their thinking is that you would have to actually aspirate for like 10 minutes to really be conclusive whether or not you're inside of a vein. So the new practice for nurses out there, no more aspiration. I do it because, I want to be as safe as possible, and if you can do it, it's a good practice to have. If you draw it up, you see some blood, what I just tell you, chunk the whole motherfucker. Get you a whole new syringe, whole new pen, whole new gear, do the whole process again. Just move over a centimeter, a millimeter, whatever. Just don't pin the same exact spot. Just move it over just a little tad bit. It's probably not going to hurt you. It's your blood. But to me, it's contamination. That's the way I view anytime something touches